I would like to call Dr. Anchin from Jaipur. She is a professor and head of unit in Department of Medicine MGH Jaipur, executive member of Jaipur API, numerous national and international publication with prominent research work. And today's topic is all the reasons why exercise is good. Over to you, ma'am.
Good morning, everyone. Thank you, the organizing committee, for giving me this opportunity. But I think Banti sir did injustice by saying that, at the fag end of the conference, he says, all that is good about exercise, you have to talk. And I think it has been discussed widely, the goodness of exercise in diabetes, obesity, and everything. I will try to do justice to this. Let me see how it goes. So, the history of exercise and when we started doing exercise is very remote. It's not something which is new to us. So, even in 5th century BC, the ancient physician Hippocrates said that all parts of the body, if used in moderation and exercised to which each is accustomed, become thereby healthy and well developed and age slowly. But if they are unused and left idle, they become liable to disease, defective in growth, and age quickly. So this was back in 5th century that we had some knowledge about the exercise. So the concept of exercise in medicine and the appreciation of these athletes' prowess were in the ancient Greek times also, and the earliest records of organized exercise as a formal means of health promotion was there in the ancient China, as well as and we practiced yoga, and it was there also. So this is not something which is new. So the notable studies which were there at that time also was first was done in as back as 1829, where the University of Oxford, and it was studied in the fishermen and the patient and the people who were in the oaring water sports. So it was done there. And then this came the coronary heart disease study in former football players, and this was a big epidemiological first rigorous study which came in 1953, which said that that chronic disease risk and rates were decreased in patients who physically did good activity. So after this, there was at least after this pioneering report, there were a plethora of evidence which stated that around 40 chronic diseases were there which could cause because of the lack of exercise, which included accelerated biological aging, bone fractures, breast cancer, depression, anxiety, gallbladder diseases, homeostasis, osteoporosis, sarcopenia, stroke, and so on and so forth. But so that was the history. Now we come to the past, present, as well as future. Unfortunately, as we can see, the fundamental link between endurance based activities and human evolution has weakened over time. So by this century, the belief in the value of exercise and health has faded so considerably that now lack of exercise, obesity has become a major health problem across the world. So this is the cartoon I liked. So it took us centuries and ages from a Neanderthal man to become upright, and it's taken just a decade for all of us to again go back to the same situation. So now we have an access to round the clock, energy dense food, nutrient poor food, inactivity, mobile phones, smartphones, so many games that the the activity and this has been decreasing, and there is a rise in morbidity and mortality because of the metabolic diseases which we are so worried about all the time. We do not have a lunch conference where I think none of us are there and we don't talk about health and diet, but then we are not actually doing it. So what is good about exercise is that, so there was this paper in 2021 which said that there are 8 all hallmarks for health, and if you do exercise it benefits all of that. So the 8 hallmarks of health are the integrity of barriers, containment of local perturbations, recycling and turnover, integration, rhythmic oscillations, homeostatic resilience, and so on. So when you exercise, it affects the hallmarks at all levels. So it protects, so once you exercise, it protects the integrity of barriers, maintains local hemostasis, improves the resilience and the homeostatic mechanism, which in turn will cause improvement in your cognitive improvement, improvement in your learning and mental health, cardiorespiratory fitness, improved metabolism, your immunity, beneficial and diverse gut microbiome, and muscle and strength training. So once we have an integrative system effect of this exercise, you have an organ crosstalk. So once you're exercising, all the organs in the body are aligned together and they affect your intestine, brain, heart, skeletal muscle, mitochondrion, everything depending on the release of the interleukins and the cytokines which are there all over. So can this exercise, a non-pharmacological intervention, stop a global pandemic? So this has already been discussed, and this has been taken from the IDF, that the 1 in every 10 individual is now a diabetic, and the death attributed to diabetes is would be close to 6.7 million. So this is something which is very alarming, and especially in South Africa and Southeast Asia, that the increase by 2045, the increase in diabetes would be about 68%. So, does exercise affect diabetes? We have enough data about it. We have enough clinical trials about it. And I will not go into the details. We'll just see that the trials which were here. So this was done in, there are many trials. So I could see more than 20,000 papers on diabetes and exercise and how does it, the physical inactivity across all groups. So when you talk about diabetes and exercise, this was the first Chinese study and it said that there was a very good effect of diet and exercise on diabetes. This was again an important study, and then came your two important trials, which were the direct trial and the look ahead trial. So all of these had the impact that exercise definitely has some impact on your cardiovascular health, mental health, especially in patients who were diabetes. So what does it do? So moving forward, we have the acute adaptations and the chronic adaptation of exercise in patients of diabetes. So how does the acute adaptations help? So when you exercise, initially there is an increase in glucagon and a decrease in insulin. It increases the cardiac output in the heart. It increases the triglycerides mobilization, increased glucose uptake in the skeletal muscle and the cardiovascular system. It affects the increase in blood flow. Chronically over time, if you keep exercising, then the effects become manifold. So you have increase in the VO2 max, there is a decrease in the resting heart rate, and the blood pressure also decreases. In the adipocytes, it has got a marked improvement that improves the insulin sensitivity as well as so many other things it does. So overall, so what happens is, so when you exercise, the chronically you have increase in the aerobic capacity, the VO2 improves, and the triglyceridemia decreases, causing all the health benefits which are there. So not only diabetes, it has an effect on the prevention of gestational diabetes, hypertension, improved cognition, hypercholesterolemia, MAFLD, and your cancer prevention. So the above are the metabolic syndrome, and we'll discuss in slightly about cancer prevention and autoimmune diseases as well. So what happens to patients who have gestational diabetes? So it has been seen that pre-pregnancy, if you are doing exercise training, it is consistently associated with the decrease in the gestational diabetes. And there was a meta-analysis recently which was done that if you are doing 140 minutes of moderate to intense exercise per week, there would be a 25% decrease in the risk reduction of gestational diabetes and hypertension. So these were the three studies which were there, which were significant in terms of improvement in gestational diabetes. When it comes to hypertension, so when you exercise, we'll discuss in details about the kind of exercises we can do. So the blood pressure would reduce by 5 to 10%. The systolic would by 10 millimeter of mercury, causing so many changes in the vascular system like we've already discussed, like renin-angiotensin modulation, reduced sympathetic activity, and increased insulin sensitivity. So these were the very good trials which were there, which clinical studies which showed the effect of hypertension on exercise on hypertension. Then again on dyslipidemia. So how does it happen? So exercise enhances a skeletal muscle fat utilization, and it lowers plasma lipids and increase lipoprotein lipase activity, and we have enough studies for this also. So what happens to cognition? This is now the recent study, especially in patients of multiple sclerosis as well, that exercise serves a non-invasive therapy for mental health, improving depression, anxiety, and I can vouch for it. I think all my patients, including me, if we exercise it, there is some kind of definitely happiness which is there. The endorphins are released, and you feel happy after exercising. So these are the studies which show that improved physical fitness correlated with improved cognition, especially in patients of multiple sclerosis as well. We also know that exercising 150 to 240 minutes per week, this was there in the hepatology journal, of moderate intensity aerobic exercise can reduce hepatic steatosis by around 2 to 4%. And the patients of MAFLD should target at least 135 minutes of moderate intensity exercise per week. The other benefits of exercise would be, so in cancer prevention also it has come up in a big way, that by 20 to 50% for each 5 kilogram per meter square increase in BMI, so there is an increase in the cancer risk. So by exercising you can help that. And similarly there are much results like this in autoimmune diseases as well. So quickly I'll go through the WHO guideline on physical activity and sedentary behavior. So it is according to the age groups. So children between 5 to 17 years of age should target at least 60 minutes a day of moderate to vigorous intensity physical activity across the week. For adults aged between 18 and 64, they should be targeting at least 150 to 300 minutes of moderate intensity. For cardiometabolic benefits, it's 150. You want to go beyond the 150 and do weight loss, it is, you have to clock somewhere between 250 to 300 minutes per week. That is the moderate intensity exercise, which includes your yoga, swimming, running, gymming. And 75 to 150 minutes of high intensity exercise, which includes your high intensity interval training. Also, it has been now recommended that you should do at least 2 minutes of strength training, which we all miss as individuals, or as well as guiding our patients, that at least 2 days of strength training, that is with dumbbells or weight or body weight training, you need to do to improve your cardiovascular benefit. And strength training for older adults more than 65 years of age, so again the guidelines are same, but there is a catch here that you should be doing it according to your physical limitations and ability. uh, Older adults should also do muscle strength training, which is multimodality. So recommendation of pregnant and postpartum women. So in patients who are pregnant and postpartum, do at least 150 minutes of moderate intensity aerobic physical activity throughout the week for substantial health benefits. Women who have been doing exercise prior to pregnancy should also continue it too for the maximum benefit. So for older adults with chronic conditions, everything is same except that varied multi-component physical activity that emphasizes physical functional balance and strength training at moderate or greater intensity should be done. And please be careful about the other comorbid condition. You have to keep in mind about the bone disorders, osteoporosis, osteoarthritis of the knee, other the frailty of the patient, sarcopenia. So combining everything, you should be guiding the patients regarding the exercise. So in conclusion, I'm well ahead in time. So in conclusion, if you have to do exercise, it's a panacea for modern ailments, offering transformative benefits for body, mind, and spirits. From fortifying the health to uplifting mood, it helps to prolong the social ties as well. That these are the additional benefits of exercise apart from the health benefits it does. So embracing physical activity either through brisk walks or yoga or team sports, it empowers individuals to heal a healthier and fuller lives. So as it is widely said, walking is the man's best medicine. So it, in this world of increasing stillness, movement remains our most potent remedy. And this is the last benefit of exercise. So exercise, because running away from your doctor's advice does not count as cardio. So other benefits is that this is you can see the morning sunrise with the esteemed guest if you are wake up early. The Zumba practice done by in the diet care, and you can ever be young because Dr. Bansi is with a team of type 1 diabetic patients, and he's right there in the center. I'm not sure whether you can see him or not, and you can always remain young. And that is me completing 21 kilometers half marathon. That gives me immense happiness and pleasure. Thank you so much for your patient listening.
Thank you, Dr.